Hi, this is Dr. Todd and this is Kayana, Gonson Spine and Wellness, and I'm going to show you how to use this neck fulcrum properly. This is used to help restore the cervical curve, the forward curve we're supposed to have in the neck. This is used at home, and in some cases we use this in the office as well, combined with other types of spinal corrective traction. I'm gonna demonstrate the setup that would actually be appropriate for Kayana's spine. So Kayana, if you can just turn to the side here, have you bend your head down a little bit. You can see how there's this bump right here. That bump is actually called the vertebral prominence. And so if you bend your head forward and you feel here, this will usually be at C7. And that's almost always the placement we're doing for a low placement. It's around C7 to T1. And what that means is that the peak, the top of this needs to be right on that bump. And so if we look at how this is shaped, there's a slope here and it's more vertical on this side. This side's more sloped. The slope side is the one that is actually going to go towards the feet, so down. And this more abrupt angle is going to go towards the base of the skull. So the way this is going to work is this peak is going to go right here. I'm just showing you this seated first, and Kayana's going to go ahead and lay down and she's going to show you how she places this. So go ahead and lay face up. So notice how low I'm pushing this on Kayana's upper back. You almost think it's on her upper back and not even her neck. But right now as she lays on that, that's going to be hitting C7 and T1. This is a lower neck placement. This is what we do probably about 80% of the time. So notice how she's laying back in extension. This should be pretty strenuous or difficult on that lower part of the neck. And another thing she needs to do is make sure that the shoulders relax down. She doesn't want to shrug the shoulders up. So the shoulders should be relaxed down like so. And she's gonna lay here for a couple of minutes initially, and then she's gonna build her way up so she can do 15 to 20 minutes at home. 20 minutes is preferable. And when she comes off of this, when she's done, here's what she needs to do. She needs to roll over to her side. Right now we're on a table, so she don't wanna roll too far because she'll end up on the floor. But she's gonna roll, and then she can reach back with a hand and pull that out of the way. And then she can roll back on her back again and relax for a minute before she tries to get up. This is essential. You never want to pop straight up when you're laying on this, especially after you work your way up to 15 or 20 minutes, because that's a really good way to injure your neck because you're in a vulnerable position when you've laid there for that long. So then she can bring herself up slowly, and that is how you use a neck fulcrum properly. Now keep in mind, it is totally normal and totally common for the neck to even feel like it's going numb on the surface of the skin. Sometimes that'll even refer up to the scalp, and the scalp will feel numb. You can take a break if that's happening, if it's too uncomfortable, but following using this at home, you should be icing for about 15 to 20 minutes. You want to put a thin layer of cloth or a paper towel between the ice pack and your skin, and you want to put that in your upper back and lower neck area following laying on this. Something else that's important to note is that this neck fulcrum has these different slices in them. And the reason that that's in there is because in some instances, we will tell you to tear one of these off to decrease the height of this. In most cases, we keep it full height. Sometimes we tear one of these off as we want this shorter. That's based on the height of your neck and the location of the placement. So for right now, if we haven't said anything about it, please don't tear these off, leave it intact. Doing this home traction is really what is going to make the difference in the outcome as you go through corrective care. And even as we decrease the frequency and intensity in the office as far as traction and exercises, this is going to stay with you and really be a good spinal hygiene practice. So almost like you have good dental hygiene, this is part of good spinal hygiene. It should be done twice a day, just like we brush our teeth. If you don't brush your teeth, what happens to your teeth?
They decay.
And then what happens?
Then they fall out.
Okay, but you can get fake teeth, right? But you can't get what?
Fake spine.
Oh, that's right. You can't. That was good. All right. Anyway, this is Dr. Todd and Kayana at Gonson Spine and Wellness demonstrating how we use this neck fulcrum.